Welcome to PIC's video on shared decision-making and contraception. At PIC, we believe that a core aspect of providing high-quality contraception care is a clinician-patient counseling interaction that is comprehensive, patient-centered, and efficient. We know that clinicians often only have 5 minutes or less to conduct this very important counseling session. So it's vital that we get out all of the values and things that are important to the patient who's in front of us for the best possible counseling session. As clinicians, you bring a lot to this encounter. You bring your knowledge of the literature about birth control methods, your previous patient's experience with methods, and possibly even your own experience with birth control or that of your partners. But patients bring a lot to this encounter too. They bring their own experience with birth control, information about methods that they've gleaned from the internet and social media, and frequently they bring the experiences of their family and friends as well. When a patient has all of the information that they need to make a decision around contraception, and they feel like they get to be the ones to make the decision, they're much more likely to use their birth control method consistently and correctly, and to be highly satisfied with the counseling experience. There are multiple key elements of a shared decision-making encounter, and you can use the mnemonic pick one to remember what each of these are. The first is past experience with birth control methods. It's a good idea to start off the encounter by asking a patient what they've used in the past, what methods they've liked, and what they haven't. It's particularly important to elucidate what has not worked for them in the past, because that's going to help you tailor your counseling today. Next, you want to ask what's important to a patient about their birth control method. Every patient's values are different about what's important in their contraceptive method. A lot of decision aids default to effectiveness being the most important value, but research tells us that there are other elements that are as or more important than efficacy when a patient is making a contraceptive decision. Elements like, what is the effect of this method on their monthly periods? Can they start and stop the method without needing a provider? And are there non-contraceptive benefits that they might get with a particular method? Next is contraindications. If you don't know the patient's history, this is a good time to ask pertinent questions about their medical history to determine if they're eligible for all birth control methods. You can ask questions around a history of high blood pressure, lupus, diabetes, other chronic medical conditions, and if they have a history of tobacco smoking. And remember, obesity is not a contraindication to any birth control method. Next, it's time to share knowledge. Now is a good time to go over all of the contraceptive options that are available to this patient. We find that using a decision aid on paper can be really useful, especially for patients that don't know what all of their options are, because this lets you use a pen and take notes on it as you're going through about what methods are good for them. But now is also the time to discuss obstacles to certain birth control methods. It's not uncommon for patients to have conflicting values about things that are important to them about birth control. Things like wanting an effective method and wanting a method that isn't a device that stays inside their body. It's not your role to resolve the conflict for them or to figure out which one's more important. Rather, you want to present the conflict to patients so they understand the decision that they have to make, and together, the two of you can decide what is more important for them. Now it's time to see if she's ready to make a decision. You can ask if she has all the information that she needs to make a decision today. If not, it's appropriate to offer the patient a follow-up appointment to discuss this further and to give her a bridge method of contraception to protect her while she's waiting for that next appointment. This could be a pack of pills, an injection of Depo-Provera, or even a supply of condoms and a prescription for emergency contraception. Last, the patient needs to experience the method that she's chosen. Let her know that your door is always open and your phone is always on for her to call or come in to talk about her experience with the method, side effects that she's having, or any other concerns. And also let her know that you're willing to change her method whenever she wants to do so. Let's watch 2 clinician-patient scenarios in action that show the principles of shared decision-making. In the first, the patient has a good idea of what they want to use, and the provider gives them the confidence to make that decision. In the second, The patient has conflicting values around what's important around contraception, so using shared decision making, the provider helps the patient come to the decision that's right for them.
Hi, I'm Dr. Cannon. How are you?
Well, how are you?
Well, what can I call you today?
You can call me Frankie.
Nice to meet you. What's bringing you to the clinic?
I need to get on birth control.
Great, I can certainly help you with that. First, tell me what's your experience been with birth control? What have you used in the past? What have you liked? What have you not liked about birth control?
I used to get the shot, but I gained a ton of weight. Lately, he's been using the pull-out method and condoms when we remember to use them.
Thank you for sharing that with me. It can be hard to find the method that's right for you. Tell me, what's most important to you about your birth control?
Well, I don't care about getting my period every month, and I hate swallowing pills. My friend recently got the IUD and said it was the most painful thing she's ever done in her life, so I probably don't want to do that. I was thinking about the thing that goes in your arm, but read online somewhere that it can get stuck.
What I'm hearing you say is that you're not really interested in using pills and that you've done some research online and talked to some friends. Does that sound about right?
Yeah.
Let's go through the different methods. We'll focus on the ones that are safe for you. We'll use this chart to talk about the methods. And first, because you have a history of high blood pressure, the hormone estrogen is not safe for you. It also sounds like you're not interested in taking the pills, so I'm going to mark those ones off. Because you had that experience with weight gain on Depo, it sounds like it might not be the right choice for right now. And I'm hearing your concerns about the IUD and potentially pain with insertion. Some women do have some issues with insertion, and it might not be right for everybody. The implant may be a really good option for you. Would you like to hear a little more information about that?
Sure.
So stop me at any time if you have questions. The implant is called the Nexplanon. It's a small device about the size of a matchstick that sits underneath your skin. You can feel it, but you can't see it. It works by releasing hormones every day to help prevent your body from releasing an egg each month. The biggest possible side effect is a change in your period. Some women will have a regular monthly period, some women will have no period at all, and others will have kind of irregular spotting. Typically, the bleeding pattern stabilizes over the first 6 months. I know you heard about the implant getting stuck in your arm. Most of the time, it stays in the correct place. And we can always take it out. There are many different ways, even if it moves or gets deeper in your arm. The implant is labeled for use for 3 years, but there's research to show that it's effective for up to 4 years. What questions do you have about the implant?
That bleeding stuff sounds scary. Can I take it out if I don't like it?
We can take the implant out whenever you want. It's your body, it's your choice, no questions asked. If you want it out, we take it out. Do you feel like you have enough information to make a decision today, or do you need some more time?
Yeah, I think I'll go with Nexplanon. Can we do it today?
We can likely do it today, and I'm really glad we found a method that you feel comfortable with. Let me tell you about the process. Before we start talking about all of the options, tell me what's most important to you about your birth control.
Well, I really need something that works. I can't get pregnant right now, and I don't want anything that goes inside my body.
All right. What I'm hearing you say is that effectiveness of a birth control method is the most important to you, and that you don't want something that goes inside your body. We're going to talk about all the methods in detail. One of the things we can talk about is that the most effective methods are the ones that go inside your body. What do you think about that?
Oh, I didn't know that.
If you had to choose between a most effective method and a method that does not go inside your body, what's most important to you?
I really don't want something that goes inside my body. It just freaks me out.
So let's talk about how to make other methods as effective as possible. We're going to use this chart to review all the methods. And based on your medical history, because of high blood pressure, the methods that contain estrogen aren't safe for you. There are birth control pills that don't contain estrogen, so we'll talk about those in a bit. It also sounds like you're not interested in the implant or the IUD. So the most effective methods for you would be the Depo-Provera shot or the progesterone-only birth control pill. Both are safe for people who have high blood pressure, and both are extremely effective, especially when used in combination with condoms or withdrawal, the pulling out method. Condoms are the only birth control method that prevent sexually transmitted infections. But if you're not worried about an infection, the pull-out method can work very well in combination with the pill or the shot. It's important to take the pill every day around the same time, and you'll expect to have a period around the same time every month. I know you have some experience with the shot. Would you like to hear more about that?
I don't want to go back to the shot, so that's out. I'll probably go with the pill and just keep using the pull-out method since that's what we've been using anyway.
Great. Let's talk about ways to make the pill the most effective for you. Taking the pill at the exact same time every day is extremely important. What would be the best time of day for you to take the pill?
I take my blood pressure pill in the morning, so maybe I can take my birth control with that.
Absolutely, that sounds great. What I'll do is send in a prescription for 3 packs of pills with 3 refills. This will give you a year's supply. To review, there's hormones in every pill, so you need to take one every day. Try it for a few months and let me know if it's working for you.
Sounds good. I feel better about having something besides pulling out.
Excellent. I'm glad we were able to find a method that you feel comfortable with.
Thank you for watching PIC's video on shared decision-making and contraception. We know that it's not always easy to get all the information that you need to provide high-quality care, to make sure you understand the patient's values and that her preferences are being met, and to stay on schedule. We hope that using the Pick One mnemonic can help you remember all of the elements of shared decision-making, leading to a more satisfying encounter for you and for your patients.